Welcome to our presentation on vital signs. Understanding vital signs is crucial for assessing the health status of patients. In this session, we will recognize common terminology and abbreviations, describe the instruments used, explain the procedures, and demonstrate how to measure vital signs. Vital signs are the basic indicators of physiological status, including temperature, pulse, respiration, and blood pressure. They change immediately with any abnormality in the body. The term vital is used because these signs are the clearest indicators of overall health. They provide initial information that influences the direction of evaluation and examination. Measuring vital signs helps assess the client's condition, determine baseline values for future comparisons, and detect changes and abnormalities in the client's condition. Vital signs should be taken at regular intervals. The more critical the client's condition, the more frequently these signs need to be evaluated. To measure vital signs, you will need a vital sign tray, stethoscope, sphygmomanometer, thermometer, second-hand watch, pen, vital sign sheet, and disposable gloves if available. Vital signs should be assessed on admission, when there is a change in health status, according to medical orders, before and after certain medications, surgery, and nursing interventions. For group work, you will be divided into 4 groups. Each group will discuss definitions, types, normal values, abnormalities, equipment, and procedures related to vital signs. Blood pressure is the pressure exerted by blood against the walls of blood vessels. It includes arterial, venous, and capillary pressures, with arterial blood pressure being the most commonly measured. Blood pressure readings consist of systolic pressure, when the heart is contracting, and diastolic pressure, when the heart is at rest. Blood pressure can be assessed directly with a catheter or indirectly using an inflatable cuff. The client should be in a warm, quiet environment, and certain conditions should be met before measurement. A sphygmomanometer is used to measure blood pressure. There are 3 types: mercury, aneroid, and electronic. The proper name for a blood pressure cuff is sphygmomanometer. It comes in different types, including mercury and aneroid. Proper positioning, inflation, deflation, and auscultation are crucial for accurate blood pressure measurement. The arm should be at heart level, and the cuff should be inflated and deflated correctly. The cuff size must be appropriate for the patient. Using a cuff that is too small or too large can result in inaccurate readings. Initial recordings should be made on both arms, with subsequent measurements on the arm with a higher pressure. The position of the patient and site of measurement should be recorded. Before measuring blood pressure, palpate the systolic pressure and ensure the patient is not talking, as this can significantly increase readings. The average normal blood pressure is 120/80ths of a millimeter of mercury. Hypertension and hypotension are diagnosed based on deviations from this norm, with specific criteria for each condition. Various conditions